Welcome to this episode of Tennessee Public Health for You, a podcast series designed to inform Tennesseans about public health and its benefits to all who live in or visit our state. I'm Kim Harrell, Executive Director of the Tennessee Public Health Association, and your host. Dr. Alisa Haushalter joins us in this episode, during which we will discuss the field of public health nursing. A seasoned professional with over 40 years of experience in academia and public health practice, Dr. Haushalter has served in a variety of public health nursing and leadership roles that include her current position as an associate professor at the University of Tennessee Health Science Center College of Nursing. She is certified as an advanced public health nurse by the American Nurses Credentialing Center and was selected by the American Nurses Association to serve on the work group that developed the third edition of the Scope and Standards of Practice of Public Health Nursing currently in effect. Recent among Dr. Haushalter's long list of achievements include her appointment to the Healthy People Curriculum Task Force, Clinical Prevention and Population Health Curriculum Framework 5-Year Revision Work Group, her election as president of the Tennessee Public Health Association in 2020, and her appointment as the association's Advocacy Committee Chair for the 2021-2023 term. As you will quickly learn from this podcast, Dr. Haushalter is a passionate advocate for nursing and public health, and I'm grateful she joined us today to share her vast knowledge and expertise. Welcome, Dr. Haushalter.
Thank you for having me, Kim. I'm excited to be here.
It's our pleasure. So, to kick off today's discussion, can you just explain a little bit about just what is public health nursing?
Now, that's a great question. So I'm going to give it a little bit of history first. Public health nursing really started as a branch of nursing when nursing started in the United States, so late 1800s, early 1900s. You had two tracks that nursing went. One was hospital-based nursing, and the other was community-based nursing, or what we call public health nursing. If we fast forward to today, the American Public Health Association defines public health nursing as protecting and promoting the health of populations through nursing, social, and public health sciences. And the reason I like to use the APHA definition is that it clearly says that we use all of our knowledge from nursing, but that we also have to have sound knowledge in the area of public health practice and the social sciences.
So, given that definition, can you explain a little bit more about the role of public health nurses and how they're different than nurses in more of a clinical setting? So what are some of the things they do and how they interact in which populations?
And I'll compare it by starting with what we traditionally call a bedside nurse or a hospital-based nurse, I think because everyone's familiar with that role. Nurses who work in the hospitals, they really serve one individual at a time. They serve that one person, sometimes their family, but primarily the person that has come to the hospital or come to the clinic setting for care. They also focus on what we call very downstream. When a person comes to the hospital and has to be admitted, they're already ill, and they need a service to get well. Or if someone's coming into a clinic setting, they already likely have some health problems. So that's the key thing that we'll focus on is who is the patient and what do we focus on. In public health nursing, we focus on populations. So an example might be a large community. So if it's a public health nurse in Knoxville, Nashville, Chattanooga, Shelby County, the nurse's patient is that whole community. Everyone who lives, learns, works, plays, and worships in that community is the responsibility of the nurse, not just one patient. And public health nurses focus upstream. They focus really on promoting health and well-being and protecting people from illness. Now, it doesn't mean we don't ever treat a patient specifically. We may do primary care. There's some areas across the state where nurses do provide primary care in public health. But that's really to fill a gap. That's not the primary purpose of what we do. It is very focused on prevention and health promotion. And with that said, that means that we focus on what everyone now calls the social determinants of health. Again, if we look at the history of public health nursing, it's rooted in social justice. The initial public health nurses started in New York, and their focus was on housing conditions of immigrants. So really focused on those social determinants, and now what we also call political or commercial determinants of health.
Interesting. That leads me to the next question, and you touched on it a little bit, but we've heard a lot lately about population health. And so can you tell me a little bit more about population health and how that differs from population health management? Do we need them both? Is one better than the other? Can you help me explain the importance to both to all of us?
Yes. I'll start with both are necessary, and they complement each other. And it really was a movement that grew out of several things, but where it accelerated was because of the Affordable Care Act and Accountable Care Act, is that it was a recognition if we were going to be a healthier country, one community at a time, one neighborhood at a time, that we all had to focus on population health. And when I say we, it's nurses, physicians, anyone who's in the healthcare system had to begin to look at data differently and drive actions that improved health of many people, not just one person. Also, there's an organization called the Institute for Healthcare Improvement, and they call IHI as a shortened term, but IHI began to focus on what are real traditional tools in public health. Things like hotspotting, determining where were people who were using the emergency room more. Or I worked at Nemours Pediatric Health System. We looked at children with asthma. We looked at children who experienced trauma. That's population health management. Again, it came out of ACA and IHI because we knew that's how we would be a healthier country. The difference critically is that in population health management, a healthcare system, a hospital, a clinic, or whatever, is going to focus on the people that it serves. So focus on the population of people with congestive heart failure. Focus on the population of people who come to the emergency room more frequently than expected. Where the public health nurse focuses on a broad community like Shelby County, Davidson County, Chattanooga, and so on. And so it's slightly different because one is all people in a community, the geographic area, generally not limited to that, but that's how public health typically works, is geography, and people in those populations that are at risk. So an example might be people at risk of COVID who live in Shelby County, people at risk of HIV in Shelby County, where the healthcare system is going to focus on patients that they serve who have HIV or patients that they serve that have COVID. So they're complementary. One's community-based, one's healthcare systems-based, and both of them are necessary if we're really going to achieve the goals and the vision of the Affordable Accountable Care Act, which is to make sure that we have a healthier nation, we provide better quality care, and that we, over time, reduce the costs associated with healthcare.
Thank you, Dr. Haushalter. That was very interesting. So given that, what kind of actions or how do they address both of these differently?
So in population health management, again, that's within the healthcare system, they're going to look at those things that they have control over. You know, what are the services that they provide to a given population? How do they communicate with that population? What services such as telehealth or other services that are available once the person transitions home, and how do they transition care and coordinate care? But it's all about health care in that system, where the public health nurse or public health system is really going to look at the conditions in which people live, learn, work, play, and worship. What are the policies that impact how people live? What are the conditions? So things like housing, are there sidewalks? Is there advertising for cigarettes? Or cigarettes readily available? Is healthy food available? And focus in that area. So again, you can see how they complement. One is really protecting and promoting at a larger community level. And then the healthcare systems are going to focus on improving health outcomes for the people that they serve by the services that they provide within that healthcare system.
So given what you just described and the description of public health nursing, can you give us some specific examples as to the impact a public health nurse can have on its community or his or her community?
Yeah, so as a public health nurse who's been in practice for 40 years, I could give you a really long list. I'm going to probably stay with big picture and look historically. We do know that in the United States, life expectancy has been increased primarily through public health efforts. And nurses may not have led all of those efforts, but I can assure you nurses have been involved in all of those efforts. So examples would be having fluoridated water has improved health outcomes, reducing deaths by motor vehicle crashes and that's seatbelt usage, car seat usage, and so on, has really reduced not only death but also injury. Things like vaccinations. Clearly, nurses play a significant role in administering vaccines or assuring access to vaccines by making them available in the community level. So those are things historically that we know nurses have been engaged in public health. But if we move really up into the more modern times, think of things like HIV/AIDS, all of our issues around tuberculosis control. Nurses have been intimately involved in all of those efforts to, one, reduce transmission, but also to improve outcomes for those particular at-risk populations in our communities. There was a recent article that indicated during COVID that health departments that were led by nurses actually had higher outcomes, less transmission, and improved outcomes in their communities over other public health systems. So we play a variety of roles. Many people envision the nurse in a white uniform doing a procedure like giving a vaccine. And that's one of the things that a public health nurse may do, but that's less likely. We don't wear white uniforms. We historically wore blue, but now we wear regular clothing and maybe even occasionally scrubs. But we are oftentimes focused on program development. We can be engaged in epidemiology, so looking at the spread of disease and looking at ways to reduce transmission of that disease. Nurses can clearly lead efforts to improve outcomes. So an example might be, and these are examples actually across Tennessee, efforts to improve breastfeeding, efforts to make sure there's bicycles available for people to ride on a bike share. So a long list of things that nurses do as public health nurses to improve the health of populations in their community. But one of the critical things that we do, and I'll end with this, is our ability to advocate. We have a responsibility based on the data and our understanding of what's happening to elevate issues so that they can be addressed either through a policy change or some type of systems or environmental change. And I'll use two examples, again from our state, is elevating gun violence as a public health issue. Nurses have been elevating that for some time. It's not limited again to nurses, but that's part of what our role would be, is to say this is an issue that can be adequately addressed if we took a public health approach and looked at it from many angles. And the other is the opioid epidemic, and being able to look at it from a variety of different angles to improve outcomes for people who suffer from opioid use disorder.
So the workforce, and given all that you described with public health nurses, their importance to the community, and keeping the community healthy and safe, how is the workforce? And what are the risks to a community if they don't have adequate public health nursing available to their constituents?
So in general, public health is having a staffing issue, as are many places. We do know, and this is a report from the Beaumont Foundation, over the last decade we've lost about 15% of the workforce in public health, and that's not limited to nurses but does include nurses. So public health workforce was already short, and then we've lost about 15% according to that one particular study. We do know during COVID, according to NACCHO, we've had about over 500 health officers or health officials resign, causing further shortages in leadership. So we do know that we're pressed for staffing in public health. Then we know there's a shortage of nurses in all areas of nursing. So you combine that, we know there's insufficient number of public health nurses in practice. Then you add on top of that, many of us are aging and retiring. And so it creates a significant gap in the workforce. And we are not necessarily preparing nurses to go into the public health workforce. That's probably a later comment, but that's, I think, critical to this. So if we don't have a sufficient supply of nurses, we're not able to provide the services that nurses typically do in a community. And again, there's a wide array of services, but if we face another pandemic, we may not have sufficient nurses to be able to respond to the pandemic. And that's looking at data, the epidemiological components of that, the educational components of that, providing vaccine, and advocating for the needs of the community relative to preventing the transmission of disease. So I do think we have to, in our country, step back and say, how do we invest in public health for the long term? It's very common in public health that when we have an emergency, like the pandemic, money is thrown into public health for a short period of time, and then it's taken out again, or there's a removal of those funds. And so we never really have a sufficient stable workforce and are not able to really mount the response to address the issues that we need to address. That example was COVID, but we have many other issues in our community. Again, we face serious issues around violence and gun violence. We face serious issues around substance use disorder, suicide. We can go through the list. And then we have historic issues. We still have tuberculosis. We still have sexually transmitted infections. The infant mortality rate has gone up. I think it's the first time in 20 years that the rate has gone up. And these are all the types of issues that public health nurses would work with colleagues to address. And so if we don't have a sufficient public health nursing workforce, we can't adequately address those issues in our communities, and they'll continue to worsen or not improve.
And the level of education and experience and skill is necessary. Not just anyone can come in and fill their role. And so given that and the tremendous opportunity for people who are exploring fields and careers, can you talk to us about how does one become a public health nurse in Tennessee? What kind of programs are available?
So it's a great question. So if you look at the national standards, a nursing student who goes to a bachelor's degree program or a baccalaureate program should be adequately prepared to enter the public health workforce as a novice nurse. And that's a misconception. Many people think, you have to have all these different experiences. But the standards are that if you graduate with a bachelor's degree in nursing, you have had exposure to and training in community public population health. A novice nurse is just that. They're just learning. So that when a baccalaureate prepared nurse enters public health, there should be an expectation that they receive specific training so that they can develop the public health skills that they need to be an effective public health nurse. Beyond that, I'll talk about educational preparation, then I'll talk about some other things like residencies and so on. Nurses can earn a master's degree in community health. They can also add to their nursing degree and get a master's degree in public health. Sometimes nurses will add a certificate in public health so that they add that extra public health component that they haven't gotten in their nursing program. And then there are doctoral programs in public health nursing leadership, advanced public health nursing, population health nursing, and similar titles, but they're all focused on preparing people at the doctoral level to lead within public health practice as nurses. So that's the educational preparation. There's a variety of different routes to go, which is very common in nursing. But again, with the new or novice nurse, there are also opportunities for residencies or other training that may be available. So an example in Tennessee is that the Tennessee State Health Department, in partnership with Belmont School of Nursing, developed a residency program so that a new nurse could go into public health and have an additional year, a very dedicated training so that they can develop the additional skills necessary to be a public health nurse. Across the United States, there's been an increased number of residencies, recognizing that a new nurse will need additional support within public health. Then if you look at the more seasoned public health nurses, many of them do not have public health nursing training. And so many places in North Carolina is another example, is they provide additional support and training to nurses who have been in public health practice for a while but need additional public health training, and that helps them build those skills. So I encourage people who are interested in public health to really, in their academic training, explore what that looks like, and to know that they can go into public health practice as a new graduate, but they also want to look for whether there's a residency program or what type of training will be made available to them so they can be as effective as they can in their roles. And then to know it's lifelong learning. I still engage in learning. I still attend webinars, sessions, formal courses to be able to build my skills as a public health nurse. So no one's ever really mastered nursing. You just continue to learn throughout your career.
You mentioned earlier about nurses in leadership positions, and not to necessarily, maybe to compare, but not necessarily to say one's worse than the other or one's better than the other. What unique perspectives does a nurse leader generally bring to their administrative role that maybe you wouldn't find in any other discipline of that person who might be in the job?
So I think there's some disciplines that might bring similar traits to a leadership role. Mm-hmm. But the nurse brings really that nursing perspective, which includes a clinical perspective. We have obviously solid clinical skills, just like any other medical trained person or nursing trained person would need to have. We also have that broader perspective as nurses around the social determinants of health and what it's like to live in the context of a family and a community, and the public health skills on top of that. So anyone who has a clinical background is going to bring those traits to that particular leadership role. But I always make a comment, and so please bear with me on this, is leadership is a discipline in and of itself. And just having a nursing degree or a medical degree or a public health degree does not make one a leader. They have to continue to study leadership and build on their initial discipline, in my case nursing, but in others, again, it may be medicine or public health, and add that leadership component to it so they can be the most effective leader possible. But we do think, and I say we as a group of public health nurses, that public health nurses do bring a unique perspective to a leadership role because they are really grounded in that clinical piece and the leadership and public health component, and also have worked closely with families and communities throughout their careers. And so they know that personal experience, what it's like to work with the communities that they serve.
Yeah. And I'm going to make a comment based on my perspective of what I've seen with nurses in public health. So correct me if I'm wrong, but it seems to me most of us who have had experiences with nurses have been in the clinical setting. And it's somewhat very important, but I see procedures being followed. Taking that and putting it in the community, I see public health nurses also doing some problem solving relative to the resources at hand. They see the issues, for example, any social determinant of health, housing or transportation or access to food, or teaching a new mother how to breastfeed and encouraging her peers to do so in a community setting. But given the limited resources, and we're still advocating for more and more and more, they're also problem solving on how to achieve that goal, which doesn't change, but do so in the most efficient and effective way. And that, to me, is an important skill that perhaps isn't given an opportunity in another setting for a nurse.
I would say probably my sister nurses in the hospital may not agree with that comment. It depends on the setting in which one works. So I'll stay in this case, I'll just stay focused on the public health nurse. Mm-hmm. The public health nursing role is a very independent role. There's an expectation that the public health nurse, again, knows nursing, mm-hmm. knows the social sciences, and knows public health. And by combining knowledge from all of those areas, they are able to assess an individual in context of the community and the community at large, and then determine what are the most appropriate next steps based on the needs of that community, and to partner with that community. So one of the things I will make comparison to hospital nursing, and this is what I share with colleagues who are nurses. In the hospital, when a patient comes there and they're ill, they're dependent on the system, and the locus of control, who's in control and charge, is the providers, the nurse, the physicians, whoever is providing services to that individual. It's the flip with public health nursing. When I'm in a community or nurses are in the community is in charge. And we have to be able to work closely with community to identify what's important to that community, to share perspective on what's important, and then to work with that community to solve that problem. And so it takes not only a large amount of information and knowledge and independence, but also takes the ability to work with people and determine how to move something forward. So what may be most important to me is not necessarily important to the community, and how do I then support the community to meet their specific goals. So here's an example I'll use from a community in Tennessee of a project that I was involved in. We're really trying to increase walkability. So how do we get people to walk more in the community? It's real easy to say educate people on walking. But when we interviewed the community and worked with the community said, well, the problem here is we have dogs running at large. There's too many dogs all over the place. It's not safe to walk. So we had to step back and say, well, what do we do here? We have to work with animal care and control to deal with the dog issue. And so it's a different way of thinking about how to solve problems and working with the community to help them identify what needs to be done and then how to move that forward. But again, it has to be done with a lot of independence. There isn't a protocol. There may be protocols. If you're working in a vaccine clinic, there's a protocol.
Sure.
If you work in a tuberculosis clinic, there are some protocols. But in working with community, there's generally not a protocol.
Right. And then you might need to come up with some kind of new solution to deliver those vaccines or increase access to those vaccines or any of those things. Like we saw in COVID, some communities bringing in other partners to help deliver those, led by public health nurses.
Yeah. The public health system can't do it all, so working with partners is a critical component of what we do, and being able to identify partners, work with them. And then the other thing that you mentioned I think is critical is the level of creativity. One of the things that you have the opportunity to do in public health is to be creative, to find innovative solutions to issues that are facing the community, particularly as I'll go back to gun violence. There's research in gun violence, but there really wasn't a lot of research in what are the methods to prevent gun violence in specific communities, because there was a moratorium on research in gun violence. That's been lifted. So we need to do a lot of innovation and creative thinking about what are the strategies and interventions that can be used to reduce gun violence in different situations. Because how a child may injure themselves in a home because they have access to a gun may be different than how a teenager with access to that same gun may injure themselves or someone else. And so we have to be creative. We have to do research. It's what Dr. Frieden called practice-based evidence. You have to try some things from an innovative perspective and then see if they work or not work and share those with others so that we can change population health more quickly.
So what you just explained tells me that there are a number of different opportunities for nurses to get involved and start demonstrating their leadership, even on a community level, running for an office or, somehow running some community group or however, because they're really doing a lot of that work in one form or fashion anyway and dealing with those individuals. You have me convinced about going back and pursuing a career in public health nursing. So
it's never too late.
No.
I try to recruit a lot of people to nursing, and every semester if I get one student who says they're interested in public health nursing, I feel like I've been successful. So if we can recruit you, we'll be happy to do that. But I do want to add something to what you said, is that public health nursing historically has been carried out in governmental agencies. But the skill set of a public health nurse really can be fulfilled and used in a lot of different places. And you mentioned those. Nurses can run for elected office. Nurses can serve in advocacy roles because that's what they've been doing in public health for a long time. They can move into formal advocacy roles. They can run nonprofit organizations. They can run their own nonprofit organizations, be a business owner or a leader. It doesn't necessarily have to be in a governmental setting. And then the other opportunity is in population health management. Again, post ACA, there's this focus on we need to focus on populations. Well, the nurses trained in that area are public health nurses. So nurses can then move into a more clinical hospital-based setting and share the skills and knowledge they know from public health in healthcare systems to help advance population health. I really didn't talk a lot about data. I said earlier there's a need to use data, but that's one of the fundamental public health skills is understanding epidemiology, biostatistics, and data. And that's what's needed in population health management. So nurses have that opportunity. The other thing that nurses can do in public health is, again, because of that data expertise, can move into informatics, which is a newer field in nursing. Mm-hmm. That is all around use of data and accessing data, interpreting that data, and translating it for others to use it to make changes.
But data is, I can appreciate it, but I've got a financial background, so I can understand the importance of data. For a public health nurse who understands the implications to that data, what kinds of things would they be looking for, and how does that benefit the entire community? For example, the potential for disease outbreaks, or...
So I don't want to appear as a data geek, but I do love information.
And I do think you won't be the geek. I think whatever you can bring, I think most of us do have a tendency to want to see some facts, whether we want to admit it or not. And I think this would be of interest to them.
Okay.
So, just share that.
So I'm going to approach data from a really broad perspective because oftentimes when we hear data, it's like you said, maybe some people close their eyes like, I don't want to hear about data because they think about just numbers. Mm-hmm. It is numbers, but it's not limited to numbers. And I'm actually going to quote the Tennessee Department of Health, and that we've got to keep in mind that behind numbers are stories and people. And so data really is all of that. So we may look at rates of disease. We may look at incidence, the number of new cases of a disease. But we also need to look at how is that disease impacting a community. What are the things that contributed to that particular disease and the prevalence of that disease? And then how can we affect change? And how do people share their story so we better understand the meaning of that disease? So it is all of that. It's not just limited to the numbers. I do think that during COVID, the public became much more aware of the data role of public health and looking at everything from the number of new cases, the reproductive rate or how fast it was spreading, the demographic data, what people are most impacted, and how then do we make decisions. So I think it really heightened people's awareness of the importance of data. But all of that is necessary. But again, it's not limited to the numbers. It's all of those things combined. And also, it has to do with how communities work. So an example I'll use, again, goes to education. If we want to get information to a community, we could sit in our offices and come up with all kinds of ways to get that information out. But that may not be how that community communicates with each other. So you have to gather data and information to determine, is it best to use social media? Is it best to be on TV on camera? Is it best to use radio? Is it best to go door to door? Who should deliver that information, and how should they deliver that information? And so that, to me, all of that is data. It's not just limited to the numbers, and that's really what public health nurses are good at because they've learned that in working with patients. Tell me your story and tell me about you. And then from there, you develop additional information and add to that, like the numbers.
which sets a great foundation for advocacy activities.
Yes.
And so, full disclosure, Tennessee Public Health Association is an advocacy organization. So how could nurses better get involved in agencies, whether it be an association such as TPHA or the Tennessee Nursing Association or any other kind of organization? Can you talk a little bit about the importance of their role and how it can benefit the communities by working with these associations?
So as nurses, I think we have a responsibility to belong to nursing organizations. And as public health nurses, we have a responsibility to belong to nursing and public health organizations, both, so that we can, one, advocate for our profession. So I'm a member of many nursing organizations. Many of them do not have a public health component. They advocate for and speak on behalf of the bedside nurse. So I have to advocate within those organizations that there's this other specialty, public health nursing. There is the American Public Health Nurses Association, so they are focused just on public health nursing. And then obviously there's American Public Health Association and Tennessee Public Health Association. All of those organizations are critical, one for professional advocacy, to speak on behalf of the profession of either nursing, public health nursing, to advocate for the profession and resources that are needed for that profession. And those resources aren't always money. It may be things like a residency. It may be access to education. It may be access to free education. But additionally, the nurse brings knowledge to that organization to help elevate what are the issues that need to be addressed. So I'll go back to gun violence. It's important as a public health nurse that as a member of TPHA or any other organization that I say gun violence is a public health issue, and as an organization, we need to be able to elevate that and take a stand on that. In addition to that, as a member of the organization, I can and do, and others should, reach out to their elected officials to speak on behalf of the organization and the priorities of that organization, building relationships with elected officials and sharing what it is that we're valuing and what's important to us. But also we have more informal ways to share information. We can write an op-ed, for example. We might do a podcast. I did a podcast recently on gun violence as a public health issue, and ways to continue to get the information out so that we can affect change to improve the health of populations. Clearly, by the tone of my voice, it's a professional responsibility to be a member of organizations and to not just be a member, but be actively engaged in the areas that align with our interests and our particular priorities. So for me, policy and advocacy is a critical place to be focused.
Well, and I appreciate you saying it's a responsibility, and I would second that primarily because there's no one else that brings that unique combination of skills, knowledge, and experience. So that's informing something that many other people don't have a broad enough perspective to make commentaries on, based on everything that you just mentioned earlier. So I have had great personal experience with nurses, mostly in the clinical setting on a personal basis, very many in the public health setting on a professional basis. And I certainly, I'm probably one of the biggest fans in general. You've certainly taught me a lot more. But I think the thing that we all don't need to lose sight on is how capable public health nurses are and how important they are to the community. And I would say, just as an advocate on this side of the fence, that they should embrace that and really, really, for the benefit of Tennessee Public Health Association and the entire communities that they serve, come in and really, really help inform what our decisions are. So we've got a couple of other things. One, I think that's important that we talked on, the risk to the profession. Now, COVID really did exhaust a lot of folks in these kinds of positions. You mentioned that a lot of them had left. That, of course, another pandemic would be a tremendous risk that I don't know that we as a larger community could weather. So and that might turn off a lot of people from going into the profession right now. But what would you say to an individual that's looking at possibly nursing, not really having had much experience in it, certainly yet, because you did mention the lifelong learning aspect of it, which certainly makes anyone in their profession much better. What kind of personal attributes generally make a successful nurse?
That's a great question. I think the most important attribute from the very beginning is caring for other human beings. That's the essence of nursing, is caring and wanting to really have an impact on others. For a public health nurse, it's wanting to have an impact on a community or a population, or sometimes a specific population, but that same attitude is there. It's an attitude of caring. But there are some other attributes that are specific to a public health nurse that I think are important. One is that level of independence. It's, as I again tell sisters who work in the hospital, or brothers, there's obviously men in nursing, is that if something goes wrong in a home, you don't really have anybody to call, right? You don't have a team that's going to come running to help you. It's quite a different kind of way to work. And so there's importance of being independent and being able to really logically think through things. But those are skills that nurses learn over time. We use a term from novice to expert. So no one knows all of that in the very beginning, but if there's a desire to work with people in their own settings, then that's a good attribute for a public health nurse, is that to be able to go into a community, meet people from all over the world, all different types of circumstances, and being able to engage with them in a meaningful, authentic way so that they can define what improved health is for themselves, and that you can be an agent of change on their behalf based on the skills that we have. Clearly, the ability to understand data is important. You have to be able to understand what the numbers mean and how that might impact the decisions that you might make. There is benefit to understand policy and how policy works, but again, that's a skill that people can learn. A lot of people don't have civics education in school anymore, so they may actually graduate high school and not really understand how policy is made. And so just having an interest in policy is important, but people can learn that skill as well. And then the last thing I would add is that concept of cultural humility or cultural intelligence. Again, in public health, we're working with people of all different backgrounds from all over the world, and it's important that you come with a posture of curiosity and a desire to learn from others, and then have some humility because your experiences may be so different, and that you want to be able to work with people, again, in an authentic way.
Dr. Haushalter, thank you so much for sharing your Saturday morning with us with all this interesting information. In closing, do you have any personal reflections you'd like to share with the audience about your career in public health?
Yeah, thank you for that question. And before I answer that question, thank you for having me today and really doing a feature on public health nursing. It really is my passion. I've been a public health nurse for 40 years, and so to know that there's a focus on public health nursing is greatly appreciated. So thank you so much for that. If I really look at my personal reflections, I think about what I share with students on a regular basis, which is that I have had a wonderful career and that I have had opportunity to continue to grow and develop throughout that 40 years and to be able to serve communities, mostly in Nashville, but also in the Shelby County area, and that I have had the ability to experience things that I don't think I would have ever experienced in a hospital, because I've had the ability to be in people's homes, to be in communities, to really focus and partner with community and other public health professionals to do a variety of things, everything from in reducing tobacco usage to helping people address their tuberculosis, or people who have HIV/AIDS and getting them treatment that they need. But when I look back, the things that really resonate with me is that I've had the ability to really lead, even as a frontline public health nurse. Being able to really not only look at what needs to be done with the community, but also what resources are needed. How do we get those resources? How do we advocate for those resources? How do we garner whatever is needed to get information and access to a community? So it's been a big part of it. In addition to that, to really looking forward, you really just, in public health, you have to look at the moment, but you also have to look 5, 10, 20 years out. I'll use Nashville as an example. We all know Nashville's thriving. That's a booming city. We all know that. Nashville didn't get that way overnight. That was really leadership planning and thinking ahead and being strategic about how do we create a thriving community. And health was part of that. Nashville's walkable. We have there's bike trails. There's bikes available, all those things. But that was because of long-term planning. And public health was intimately involved in that. And so those are things that I was able to do as a public health nurse that I probably would not have done in a hospital-based setting. The other is I really, really encourage nurses to consider their role outside of a hospital and explore public health nursing as an option for them. And then I just want to say this is sort of a double pleasure in that this actually month, we know that the American Public Health Association, their public health nursing section, is celebrating its centennial. So there's an increased focus on public health nursing, in part because of the centennial. So again, I appreciate you taking the time. I hope that people who are, interested in nursing will hear this, and those who are interested in public health nursing will really consider it as an option. Thank you.
A list of professional organizations for nurses and other publications used to support this podcast content or provided to you as recommended sources to learn more about public health nursing can be found on Tennessee Public Health Association's website at tnpublichealth.org. Additionally, beginning in February, Tennessee Public Health for You will honor public health nurses by recognizing individuals in the field across Tennessee. I hope you will join us for this showcase series, which is sure to enlighten you about some very committed individuals who work tirelessly in your own communities.